I had just come back from a ski trip with a bunch of friends out in Utah in February of 2011 when I had this first a bit of blood in my urine and it really freaked me out. I had never heard of bladder cancer before. We got the results back from the pathology on a Monday. I saw the surgeon on Wednesday and had the surgery the following Tuesday. So as far as providing healthcare, it was immediate. Nothing to fault in the healthcare system. It worked as well as can be expected.
So life was pretty busy. We were traveling, initiating our retirement plans, seeing different parts of the world that we had never traveled to. Physically, it was a very active life. On a more intimate level, our personal lives were, as empty nesters and being back in the city, we had a very active, intimate life, which we enjoyed tremendously.
I spoke to several men who had had similar surgery, but what was lacking was, of course, the big downside of bladder and having a man having a bladder and prostate out is that your sex life essentially disappears, and little talk of that. I have been left with this perineal pain following the surgery and the chemo, so I have to take the medication to offer me some sort of relief. It affects your cognitive abilities significantly. Regrettably, I have to live with that. That's mostly fine. One of the downsides of the chemotherapy was, of course, I lost a lot of my balance. So I couldn't run outside anymore because I'd fall down. But I do bike most days, and quite often I'll do 15 or 20 kilometers. No problem at all.
The first 3 years were physical and psychological adjustments and having to try out what can be part of our lives and what can't be part of our lives. By the 5th year mark, our moods were back the way they were before all this joined our lives. As the surgeon said right at the very beginning, you are lifelong patients of mine. You know that I will be following you forever to ensure that if metastasizing occurs, we're on top of it and can capture it early.
It changes you, unfortunately, and the changes are all on the downside. And there's few opportunities to, I guess, look at the brighter side of life. And that's where the psychosocial assistance would be helpful to just be able to know exactly what happens.
Start a journal. Write questions. Anything that comes to your mind, brainstorm from both of your perspectives. We did that so that as the doctor was talking, I could write in the answers, and anything that wasn't brought up in that appointment, those became the questions that we posed to the doc. Think about what is the defining moments of your love and redefine it.
It's difficult. It's still difficult, but we've adapted.